Okay, thank you, Emma. My name is Ida Hudig, and I'm in a compliant and accountable systems group, which is at the computer science department in Cambridge. But my research is a combination of law and computer science and policy. It's very interdisciplinary, and I'm doing different kinds of projects. Right now, I will kind of give a deep dive into projects about fertility tracking, but I also do projects related to IoT, which I will also share a little bit about. It's nice that you're all here. If you have any questions, please feel free to interrupt me, because it's nice when we would have a discussion also at the end. And if you're watching this online, also feel free to, I don't know, reach out later. To give any input or opinions, because it's nice to take this further. So before I start talking about fertility trackers, I would first give a little bit of context, and I will talk a little bit about my research of the Internet of Things. So a while ago, I did a study about what happens with the data from our smart devices. So, for example, fitness trackers, security cameras, baby monitors, and we also looked into how transparent the smart device vendors are about data use. So we got 11 different types of smart devices. And these included some devices that are collecting health data, and also some devices that are collecting data from children. And then we set up a data monitoring infrastructure to capture the network traffic between these devices and the apps and the internet, both for devices that were connected with a Wi-Fi connection directly to the internet, and also for devices that had a Bluetooth connection, like a wearable, for example. And then we looked at, among other things, we looked at the number of IP addresses involved in the data transmissions from devices to get an idea of what kind of organizations and what countries could be involved in the data transmission. So we used third-party IP lookup services to identify organizations and countries. And we found that on average, there were about 12 different organizations involved in the data transmissions, and about 7.5 different countries. So we had these numbers, and we did look a little bit in the volumes of information sent, but we didn't have an idea of what's going on. So then we used some legal rights, the right of access and the right of data portability, to get some context, to understand who is actually receiving the data, for what reason, what are they doing with it, and that would ultimately allow us to kind of understand the impact, was the idea. I won't go into detail because there's all this GDPR background, but in practice, these were like certain rights, requests that we sent via emails, and organizations are usually, in general, obliged to respond within 30 days. And then we looked at the potential to exercise rights. So how is it going? Can we actually exercise these rights in practice? The form of responses, and to what extent the responses aligned with our request. Again, I won't go into too much detail, but we found that it's actually often very hard to reach these vendors, and it's hard to find the contact details sometimes. Often we didn't receive a response, and then when we did receive a response, it was often quite inconsistent in forms. There was different types of formats, and often it lacked a description of the data, so it was hard to understand. And responses were also often incomplete, and with incomplete I mean that they are often not aligned with the request, so they would be very general or high level, or only touch upon some aspects of the request. So this is our research in a nutshell. We published a report about it, and there's also a paper about it. But in short, this is the conclusion. So we identified the troubling status quo. I quote from our paper: smart product users have minimal agency over their data, while the vendors operate with little to no accountability, because we have very little transparency in what's actually going on. And intuitively, we felt this is particularly concerning with devices that collect data from children, health data, but of course also devices that collect highly intimate data. So we got curious about especially this third category, and therefore we started to do our follow-up research, which I'm going to be focusing on today. So we were interested in what happens with the data collected by fertility trackers, and how do people feel about sharing very intimate data, and can we co-design data transparency and control mechanisms in this context? So what are fertility trackers? Fertility trackers are apps or devices that assist in self-monitoring menstrual cycles, pregnancy, menopause, and any related reproductive or sexual health patterns. So this is an example of a fertility tracker app. In a fertility tracker app, you typically enter your menstruation date and it will predict your ovulation window. But it also collects all other kinds of data, such as moods, activity levels, physical symptoms, STDs, sex drive, activity. Apps are sometimes connected to a physical device that can monitor body temperature, hormone levels, or other types of data. So essentially, fertility trackers are driven by data, by highly intimate data. And based on the data, they may identify patterns and make predictions. So our research had three key aims. So first, we aim to gain insight into the actual data sharing practices of fertility trackers. So just like we did with the IoT study I just showed, we applied the same methodology in the context of fertility trackers, but I will now give a little bit more detail. Second, we work with users, so to fully develop a nuanced understanding of user preferences and attitudes towards fertility tracker data sharing. And then third, we provide recommendations for concrete transparency and control mechanisms in design of fertility trackers. So this is our approach. Two studies focus on building an understanding of the problem. So we provide an understanding from a technical perspective. So to understand actual fertility tracker data transmissions, we conducted a technical data flow analysis. And then to understand people's attitudes towards data sharing, we conducted a questionnaire. And then the third study offers a basis for a way forward because it provides insights based on co-design sessions with users to design concrete transparency and control mechanisms. So part one, we started with selecting 8 different fertility tracker products. And in this table, you'll find a pseudonymized overview. The products include 4 standalone apps and 4 device app pairs. And the selection was based on popularity of apps, but also diversity in the headquarter location of the vendor or the provider in features and functionalities. We included one benchmark tracker that claimed to process the data only locally on the device. We then set up a monitoring access point to capture the data flows between the tablet on which the apps were installed and the internet. This provided us with access to IP addresses, bytes, timings, and other data. And then where we used the physical devices, these were connected to the tablet with a Bluetooth connection. So this is similar to what I showed before the IoT study. And then these are the findings. So we analyzed the network traffic and we found that the fertility trackers potentially engage with various different entities. So on average, each tracker connected to 54.5 IP addresses. And then we used, again, third-party IP info providers to connect organizations and countries to these IP addresses. And we identified 13.5 different organizations and 7.5 different countries that are potentially involved. While the experiments were conducted in the UK, we noticed a lot of cross-border data flows, including to countries outside of the UK or even outside of the EU. So, for example, to the US, Ukraine, Russia, and Moldova. So transmissions to these countries can be concerning for data protection rights, since these countries have different data protection standards compared to the EU and the UK. We further found that the data transmission strongly correlate with user interaction. So here you see a graph with the volume of data and the timings. And this is an example of a Bluetooth thermometer, where we link the data transmissions to specific timings of interactions, such as what you see here after temperature measurements, or at the times where the user enter intimate information, such as menstrual dates, dates of sexual intercourse, and cervical fluid details. So this allowed us to infer that data was being transmitted at the time that it was being entered. So we observed correlations between interactions and network activity. This was visible across all but one of the fertility trackers that we looked into, and the exception was the tracker I mentioned before that claimed to store the data only locally on a mobile device. So in our paper, we also provide some examples of how custom privacy settings may impact data transmission patterns, such as an anonymous mode or limit data sharing with third parties. So yeah, you can check it out in our paper if you're interested, or reach out to me. So the next study was a questionnaire to understand people's preferences and attitudes. The questionnaire was completed by 162 people, including non-users. So we made up a scenario of a hypothetical fertility tracker app named Strawberry, and we simulated the setup process of a tracker where respondents were shown pop-up requests for data sharing. And they had to select the types of data they were willing to share with a specific stakeholder that they were presented. And we presented 8 potential recipients, including the app provider, an academic research group, health insurance, employer, partner, and other stakeholders. So here you see an overview of the stakeholders. And we found that the type of recipient significantly influences the willingness to share the data. So respondents often expressed a higher willingness to share data, where they assumed that there were personal benefits or benefits for society as a whole. So this was particularly the case with sharing data with their medical doctor or donating data for academic research. We then asked the same question, but we now told the respondents that the data was de-identified. And we did this to understand the effect of de-identification on the willingness to share data. And this is the outcome. So we found that respondents had a significantly higher willingness to share data when it was de-identified. But still, many respondents didn't fully trust certain stakeholders, especially online advertisers or employers with their data. And some also expressed concerns over re-identification. So this is the case where data can still be linked back to individuals. Then we also looked at the impact of different factors on the willingness to share data. So we asked them to select the factors that influence their willingness to share data. That's the first thing we did. You see it in the first column. And we found that many factors, almost all factors represented, are simultaneously influencing the willingness to share data. But the most important factor, so secondly, we asked them to rank the factors, and the most important factors for them were the specific purposes for which the data was collected and whether the data is de-identified. And then we looked into the appetite of respondents for transparency and control mechanisms. And we found that respondents strongly favor these options. So for instance, over 90% wanted to know who has access to their data or manage their data sharing or de-identification. So this set the stage for the final study, which I will talk about in a little bit. There was also, just wanted to cover this as well, there's also the option for local data storage on a device. And this was the only option where respondents were a little bit more divided because some felt like well, someone said, I'm not a star from Hollywood, but few hackers showed it's really easy to hack the cloud. So they felt like they wanted the data to be stored on a device because it could be more secure in a way. But then other people were concerned about losing all the data if their phone breaks. So this again shows more like a nuanced perspective on these privacy related or data control options. So based on these insights, we conducted focus groups aimed at co-designing transparency and control mechanisms with users. So we recruited 15 participants. They were distributed over 4 different focus groups. And each focus group included one non-user to have more fresh perspectives. And we first spoke with them about concerns and whether they have any concerns relating to data sharing through fertility tracker apps and devices. So some people say, well, I'm not so concerned since I don't provide so much detailed information. And someone said, maybe someone knows my menstruation periods, but it's not that important to me. But this was, some respondents shared this perspective. And we also noted that some said like, well, it seemed like they were already kind of managing their data by not providing most intimate data, but for example, only their menstruation dates, and which for them didn't feel like very intimate data. But there were also people that were very concerned. So there were fears that data from fertility tracker apps could be used to regulate women's bodies after Roe v. Wade in the US and threaten bodily autonomy, someone said. And someone else said, well, I deleted the app because I read their privacy policy and it really freaked me out. So there are different kinds of concerns expressed. We talk a little bit more about this in the paper. And then what we did is we asked participants to come up with mechanisms for more transparency and control across 4 fertility tracker usage life cycle stages. And this ultimately resulted in 10 concrete transparency and control mechanisms. So the first stage is about selecting a fertility tracker app or device. So this is when someone wants to start tracking their menstruation or pregnancy or menopause, and they are just thinking about, okay, what app should I use or what device should I buy? The second stage is about setup and configuration. So someone downloaded an app, got a device, and they're setting up perhaps an account, managing their settings, connecting the device to the app. So this is this phase. And the third phase is about using the app or device. So this is when they're entering the data in the app. Perhaps they're logging some symptoms. They are using a device for monitoring their body temperature, and it's syncing with the app. So this is all the use phase. But then we also included the post-use phase. And probably you're all familiar with when you're using a certain app for a while, and then at some point you enter some data, but at some point you stop using it, but it's still installed on your phone or you deleted it. And there may still be data in the app or owned by the organization, and you don't think about it anymore. So we asked them, like, what do you want at this phase as well? So I'll go through the mechanisms. In the end, if you want to know more, you can ask some more detail, go through it in a more high level way for now, because it's a lot. So in the first phase, we found we identified some preferences for transparency. So users often express a preference for simple summaries on the download platform. So for example, in the app stores, they want to have like previews and screenshots about what the app is doing, but also about the mission statement of the app provider and information about what data is being tracked. They also wanted short explanatory videos and other visual aids like infographics, again about someone mentioned that they wanted insight in the profit models from the provider, and someone else about a video from an app provider on accuracy, data use, data collection, all these things. And then a third idea was having independent platforms for comparison. So they were suggesting consumer agency websites where you can allow, where you can kind of filter fertility tracker apps based on your key priorities, including data sharing preferences. Then during setup and configuration, many participants mentioned they want onboarding screens with clearly marked mandatory fields. So this could look like pop-up windows explaining how the data is used throughout the setup process. But also what was often raised is that they wanted clear marks indicating what data is mandatory and what is not. So what's required for functionality. So this kind of refers to some kind of a trade-off that often emerges a theme in the discussions, a trade-off between what's in it for me and how much of my privacy do I need to give up. So if they need to provide very intimate data, but it can improve the services that they are, or like the profits, like what they're gaining from using the app, they're quite happy to share it in some cases. But if there's nothing in it for them, they don't. So this is also something they wanted more clarity in. They wanted there more options, so educational content on women's health, all kinds of things. Then for control, they wanted information windows with toggle switches to control data sharing option, consent, and then finally they wanted selective agreement to terms. So some felt like, well, I usually click accept all, but actually I want to select some terms and maybe some not. They wanted simple language, easy to read terms and conditions, and easy navigation options to the terms. Then during use, we spoke a lot about real-time transparency and flexible control. So if there's anything changing in data policies, they wanted pop-up notification, real-time alert, but also the possibility to disagree with this without it affecting the app, the functioning of the app. And they wanted data export and migration tools. So they wanted a tab in the settings or a button for data migration options, also to allow you to donate data, for example, with healthcare professionals, or to do your own analysis, perhaps with the data, or move to a different app. Then in the post-use phase, participants spoke a lot about information on post-use data use. So what happens with the data after you use it? Is it going to be deleted? How are you sure that it's going to be deleted? And then finally, again, they want a data deletion export option. So again, the option to extract data for own analysis, but also a pop-up offering to donate anonymized data for research purposes. So these are like a lot of different mechanisms that can be implemented by designers and developers in an app that wish to make it more aligned to user transparency and control needs. But we also reflected on these options, and I will share a little bit about the considerations that we had or that came up in the discussion. So after designing all these mechanisms, we did it in a Miro sheet. So this is kind of a collaborative design software, simply put. I showed the Miro and I said, like, what do you feel? Like, what do you think? And many people said, well, I think it is really cool to have all these options. But some people also said, well, it's also a lot of responsibility and it's hard to assign responsibility to one person. It should be everyone's responsibility. And some people spoke about user burden. So some said, well, if there's an option to accept minimum permissions, I choose it. But if it doesn't, I just click accept all, because it's just a lot of work to kind of micromanage my settings. Someone else said in a survey, well, I prefer all or nothing. It's very burdensome to select which I share and which not. Maybe I'll just download a different app. So these are themes that came up. We need to balance it with user burden concern. And then naturally the theme of user support emerged. So someone said, for example, well, I feel like putting the responsibility on the user is not bad per se, but I think there also comes a responsibility for the app itself to make sure that we are informed correctly in a way that is easy for us. So the app also has a responsibility for managing our data in a responsible way. Some said, well, there's a role for regulators. I think there should be more laws protecting consumers while we're constantly protecting ourselves. There were also ideas about standards. So someone raised the idea of like an ISO standard, and someone else said, well, we have like a vegan sign on cosmetics, on beauty products. Why not have a similar thing on fertility trackers? Another theme that emerged was gender, of course. It was not the central theme of our research, but naturally it occurred. So, for example, people raised the concern, we're tracking this for women, but men don't get tracked, raising concerns about gender surveillance. Why are we collecting more data from women compared to men? That's kind of intuitively concern that was raised by people. But then on the other hand, some people said, well, we collect so much data around women's fertility and period tracking, but we know so little about women's health issues or fertility related issues. And there's kind of a paradox here. From that, we had discussions about data donation. So I mentioned it before, it kept occurring in the data. Many people that participated in our study started talking about donating data for women's health research to academic institutions, especially also in the design option, people want a data donation option. So this is something very interesting to explore, I think, in future research. Then there's also some kind of nuance to add, that there's a difference in automated data sharing versus self-initiated data share. So you find people are not necessarily opposed to sharing data, but they want to do it for purposes that align with their values. So whether they see personal benefits or benefits for society as a whole. So again, this related to donating data for women's health research, but also communicating with healthcare providers, or people mentioned that they wanted to share data with their employer when they have reproductive health issues, or perhaps with their partner for pregnancy planning. So it was not that binary that people, it was not as if people don't want to share data, but they said, well, why should the app share data? I want to do it for my own initiative. So in conclusion, with our technical data flow monitoring, we identified many data transmissions to various countries and organizations, and we could link these data transmissions to the use of fertility trackers. Then in the questionnaire, we found that the willingness to share data depends on the context and on the stakeholder. So these studies together build some kind of understanding of data sharing practices and data sharing preferences. And finally, in focus groups, we co-designed 10 concrete transparency and control mechanisms across the fertility tracker life cycles with users. And these mechanisms provide a basis for a way forward in fertility tracking, or in the design of apps and devices in fertility tracking, but perhaps also in other domains where they share intimate data, such as sleep tracking or mental health apps, or all kinds of things where it could be useful exploring the applicability of these mechanisms. So this is our paper written with Jat Singh, my PhD supervisor, and Emma's PhD supervisor. You can scan the QR if you want to see the paper, to read it. It gives a lot more detail. And again, yes, I would love to hear from, if you're watching this live or watching this later online, I would love to hear from researchers, designers, developers, entrepreneurs, policymakers, anyone working in this field, to have your input, have questions, would be great. Please get in touch. Thanks.